Immunizations are an important part of maintaining your personal health, both on and off the job. OSHA requires employers to make the hepatitis B vaccine available free of charge to all employees who have the potential for on-the-job exposure. Furthermore, should an exposure occur, employers are required to provide post-exposure evaluation and follow-up. Appropriate protective equipment should be used whenever exposure to blood or other potentially infectious materials is likely. This equipment includes disposable gloves, gowns, eyewear, masks and shields, resuscitation devices, and breathing barriers. All are designed to prevent you from making contact with infectious materials, which can greatly decrease your risk of contracting or transmitting a disease. But it is not enough to have these devices available. You must know how to use them. Disposable gloves in latex, nitrile, or vinyl should always be worn when there is a possibility you could contact blood or other potentially infectious materials, directly or indirectly. Wearing gloves minimizes the exposure to blood and other potentially infectious materials. In general, jewelry should not be worn where the potential for risk of exposure exists. When removing gloves, partially remove the first glove by pinching the glove at the wrist, being careful to touch only the glove's outside surface. Pull the glove toward the fingertips without completely removing it. The glove is now inside out. Remove the second glove by pinching the exterior of the second glove with the partially gloved hand. Then pull the second glove toward the fingertips until it is inside out. Then remove it completely. Finish removing both gloves by grasping both gloves with your free hand. Touch only the clean interior surface of the glove. After removing both gloves, discard them in an appropriate container and wash your hands thoroughly. Here is another acceptable method of removing gloves. Remember, the objective is to remove them without touching the outside of either glove. Never handle personal items such as pens or combs when wearing soiled gloves. Breathing barriers include a variety of resuscitation masks and face shields. These devices are placed between you and the victim's mouth and nose to prevent you from making direct contact with body fluids. You should know how to use any devices made available to you. Always change masks between contact with different people. Now that you know what you can do to protect yourself, let's talk about what your employer can do. Your employer is responsible for implementing engineering and work practice controls as part of the exposure control plan. Engineering controls are physical devices that isolate or remove a hazard from a workplace. Examples include sharps disposal containers, self-sheathing needles, and safer devices such as sharps with engineered sharps injury protections or needleless systems. Work practice controls alter behavior. For instance, in certain situations, your employer may require you to wear protective equipment, such as gloves. Changing the way sharp objects, such as needles, are handled can prevent needle stick injuries. Together, engineering and work practice controls greatly reduce your exposure to infectious hazards. Proper handling, cleaning, and disinfecting of soiled equipment, supplies, and other materials is important in preventing disease transmission. It combines both work practice and engineering controls. Sometimes an incident may result in a spill of blood or body fluids. Your first step in dealing with a spill is containment. Commercially available containment units designed for hazardous materials are very effective. Any absorbent materials can be used if they are disposed of properly. To manage a spill, follow these steps. Always wear single-use disposable gloves and other protective equipment when cleaning up spills. Clean up spills immediately or as soon as possible. If the spill is mixed with sharp objects, such as broken glass and needles, do not pick up these items with your hands. Use tongs, a broom and dustpan, or 2 pieces of cardboard. Use absorbent materials to clean up the spill and dispose of the materials in a labeled biohazard container. Flood the area with a disinfectant solution and allow it to stand for at least 10 minutes. A recommended disinfectant solution is a fresh mixture of 1 part bleach to 10 parts water. Use paper towels to absorb the solution and put the paper towels in the biohazard container. Review the exposure control plan with your employer for equipment and procedures specific to your facility. The OSHA standard also requires that the work area be kept clean and sanitary to help prevent exposure to bloodborne pathogens. Specific procedures for cleaning and disinfecting equipment in your workplace should be outlined in the exposure control plan. Handle all soiled supplies, equipment, and other materials with care until they are properly cleaned and disinfected. Place all used disposable items in labeled containers. Place all soiled clothing in marked plastic bags for disposal or washing. Scrub soiled boots, leather shoes, and other leather goods such as belts with soap, a brush, and hot water. If you wear a uniform to work, wash and dry it according to the manufacturer's instructions. Floors, decks, countertops, and ambulance and automobile seats must be cleaned before using a disinfectant solution. Exposure incidents involve contact with blood or other potentially infectious materials through a needle stick, broken or scraped skin, or the mucous membranes of the eyes, nose, or mouth. If you have an exposure incident, wash needle stick injuries, cuts, or exposed skin with soap and water. Flush splashes of blood or other potentially infectious materials to the nose and mouth with water. Irrigate eyes with clean water, saline, or sterile irrigants. Following any exposure incident, you should immediately report the exposure incident to your supervisor and follow the steps in the exposure control plan for confidential medical evaluation and follow-up. Employers must maintain a sharps injury log for the recording of injuries from contaminated sharps. The log must maintain employee privacy, list the type and brand of the device involved in the incident, include the location of the incident and description of the incident. This training is only a part of an overall exposure control plan. This plan is an important step in eliminating or minimizing employee exposure to blood or other potentially infectious materials. Minor changes can make a major difference in minimizing occupational hazards that may jeopardize your health. Remember, by practicing good personal hygiene, using personal protective equipment, and following engineering and work practice controls, you will take a big step towards safeguarding yourself and others against disease transmission.